Hello everyone, welcome to today's video. In this video, we will be discussing the impact of hemorrhagic fevers on affected communities. Hemorrhagic fevers are a group of viral diseases that can cause severe bleeding and organ failure, leading to a high mortality rate. Not only do these diseases have significant health consequences, but they also have social, economic, and psychological impacts on affected communities. In this video, we will be discussing 10 helpful pieces of information that shed light on the effects of hemorrhagic fevers on affected communities. We will cover the social stigma and discrimination that can arise during outbreaks, the displacement of communities, and the long-term health effects of the diseases. We will also discuss the strain on healthcare systems and the need for collaboration among healthcare providers and public health officials to develop effective prevention and treatment strategies. So, without further ado, let's dive into the 10 helpful pieces of information about the impact of hemorrhagic fevers on affected communities. 1. Hemorrhagic fevers are a group of viral diseases that can cause severe bleeding, high fever, and organ failure. These diseases can affect multiple organ systems and often have a high mortality rate, with some outbreaks resulting in hundreds or even thousands of deaths. The severity of these diseases can vary, but they can cause significant health and social impacts on affected communities. It's important to take measures to prevent the spread of these diseases and to develop effective treatments to mitigate their effects. 2. The impact of hemorrhagic fevers on affected communities can be devastating, both in terms of the immediate health consequences and the longer-term social, economic, and psychological impacts. Outbreaks of hemorrhagic fevers can cause panic, social stigma, and discrimination against affected communities. The closure of schools, businesses, and other public institutions can lead to loss of income and economic hardship. Hemorrhagic fevers can also lead to the displacement of affected communities as people flee to avoid infection or seek medical care, leading to a breakdown in social structures. The long-term effects on the health of affected individuals, including chronic fatigue, joint pain, and neurological problems, can also have significant social and economic impacts. It's crucial to address the broader impacts of these diseases on affected communities, as well as to develop effective prevention and treatment strategies. 3. Outbreaks of hemorrhagic fevers can cause panic and fear among affected communities, as well as the wider public. In some cases, this fear can lead to social stigma and discrimination against affected individuals or communities, including avoidance or ostracism. This can make it challenging for affected individuals to access healthcare services, receive support from their communities, or continue their normal lives. It's crucial to address the fear and stigma associated with hemorrhagic fever outbreaks, as well as to provide accurate information and resources to help prevent the spread of these diseases and support affected communities. Education and awareness campaigns can play an essential role in reducing the social impact of hemorrhagic fever outbreaks and promoting community support and resilience. 4. Outbreaks of hemorrhagic fevers can lead to the closure of schools, businesses, and other public institutions, as a measure to control the spread of the disease. This can result in a loss of income and economic hardship for affected individuals and communities, particularly those who rely on daily wages or small businesses for their livelihoods. The economic impacts can be long-lasting and may take time to recover from. In addition, the indirect effects of the outbreak, such as decreased tourism and trade, can also have significant economic consequences for the broader community. It's important for public health officials to work closely with affected communities to minimize the economic impacts of outbreaks and to provide support and resources to help individuals and businesses recover. 5. Hemorrhagic fevers can lead to the displacement of affected communities, as people may flee their homes or villages to avoid infection or seek medical care. This displacement can lead to a breakdown in social structures, as families and communities are separated, and people may be forced to seek shelter in unfamiliar locations. The displacement can also result in a loss of income and education, particularly for children who may be unable to attend school due to the outbreak. The breakdown in social structures can lead to increased stress and psychological impacts on affected individuals and communities. It's crucial to provide support and resources to help displaced individuals and families, including shelter, food, and medical care, as well as to work to rebuild social structures and community connections in the aftermath of an outbreak. 6. Hemorrhagic fevers can have long-term health effects on affected individuals, even for those who survive the acute phase of the disease. Some individuals may experience ongoing health problems, such as chronic fatigue, joint pain, and neurological problems, including seizures and memory loss. These long-term effects can significantly impact the quality of life for affected individuals and their families, as well as the broader community. It's crucial for public health officials to provide ongoing support and resources to help affected individuals manage these long-term health impacts, including access to medical care, rehabilitation services, and mental health support. It's also essential to continue research efforts to better understand the long-term health impacts of hemorrhagic fevers and to develop effective treatments and interventions to mitigate these effects. 7. Hemorrhagic fevers can have a significant impact on healthcare systems, particularly in resource-limited settings. Outbreaks of these diseases can quickly overwhelm healthcare facilities, leading to a shortage of resources, healthcare workers, and emergency services. The need for specialized care and isolation facilities for infected individuals can also strain healthcare resources, leading to delays or disruptions in other healthcare services. This strain on healthcare systems can have a ripple effect on the broader community, as individuals may be unable to access critical healthcare services or experience delays in receiving care. It's crucial to prepare healthcare systems in advance of outbreaks and to provide ongoing support and resources to ensure that healthcare workers and facilities have the necessary supplies, training, and support to respond effectively to these diseases. This includes developing surge capacity plans, establishing adequate infection prevention and control measures, and providing mental health support for healthcare workers who may be at increased risk of burnout or psychological distress during outbreaks. 8. The response to hemorrhagic fever outbreaks requires collaboration among healthcare providers, researchers, and public health officials to develop effective prevention and treatment strategies. This collaboration can involve a range of activities, including surveillance and early detection of outbreaks, development of diagnostic tools, treatment and management of infected individuals, and implementation of effective prevention strategies, such as vaccination and infection prevention and control measures. It's crucial to ensure that all stakeholders are engaged in the response to outbreaks, including affected communities, to ensure that prevention and treatment strategies are culturally appropriate and effective. Collaboration can also facilitate the sharing of information, resources, and best practices, which can improve the overall response to outbreaks and help mitigate their impact. It's essential to continue investing in research and development efforts to better understand these diseases and to develop new prevention and treatment strategies that can save lives and prevent the spread of these deadly viruses. 9. Vaccines and antiviral drugs are available for some types of hemorrhagic fevers, such as yellow fever, Ebola, and Lassa fever, but there is still a need for continued research to develop effective treatments for all types of hemorrhagic fevers. In some cases, available treatments may not be effective for all individuals or may have significant side effects, highlighting the need for new, more targeted treatments. Developing effective treatments requires a deeper understanding of the biology of these diseases, as well as investment in research and development efforts to identify and test new drugs and vaccines. It's also essential to ensure that new treatments are accessible and affordable for individuals and communities affected by these diseases, particularly in low- and middle-income countries where the burden of hemorrhagic fevers is highest. Continued investment in research and development, as well as efforts to ensure equitable access to effective treatments, can help reduce the impact of hemorrhagic fevers on affected communities and save lives. 10. Education and awareness campaigns can play a critical role in reducing the spread of hemorrhagic fevers and addressing the social and economic impact of outbreaks on affected communities. These campaigns can involve a range of activities, such as community outreach and education, public messaging and communication, and engagement with healthcare providers and other stakeholders. Education and awareness campaigns can help to increase understanding of the signs and symptoms of hemorrhagic fevers, as well as the importance of early detection and treatment. They can also help to dispel myths and misconceptions about these diseases, reduce stigma and discrimination, and encourage individuals to seek care when they need it. In addition, education and awareness campaigns can help to address the social and economic impact of outbreaks, by providing information on available resources and support services, and by fostering a sense of community resilience and solidarity. Effective education and awareness campaigns require collaboration among a range of stakeholders, including affected communities, healthcare providers, researchers, and public health officials, to ensure that messaging is culturally appropriate and effective. By increasing awareness and understanding of hemorrhagic fevers and their impact, education and awareness campaigns can help to save lives and prevent the spread of these deadly viruses. Thank you for watching today's video on the impact of hemorrhagic fevers on affected communities. We hope that this information has helped shed light on the devastating effects of these diseases and the importance of developing effective prevention and treatment strategies. Remember, education and awareness are crucial in reducing the spread of hemorrhagic fevers and addressing the social and economic impacts of outbreaks on affected communities. We can all do our part in raising awareness and supporting research efforts towards finding effective treatments and vaccines. If you found this video helpful, please don't forget to give it a thumbs up and subscribe to our channel for more informative content. Thank you for watching, and we'll see you in the next video.